I do a video. Now I say, ah.
My kids, I hate that their whole lives basically will be me being sick. They're not gonna. They're not going to really know any different.
Happy birthday, dear Johnny Kira. Happy birthday to you.
The only things I remember from that were saying, am I going to die? Are we having a girls' day?
Yep.
So I really didn't start feeling sick or like things were off for too terribly long. My first, sign that something wasn't right was just about 2 months before my diagnosis. It was December of 2021. I noticed that I started having really bad back pain. It wasn't all the time, but when I had it, it was severe. It was like sharp stabbing pain, like my shoulder up here, and it was bad. I started having a lot of sinus issues. My nose was draining constantly. I couldn't get it to stop. No amount of blowing my nose would stop it from draining. I started to lose hearing in my left ear. I'd wake up in the morning and would be basically deaf in my ear. And then it would take a couple of hours to get the hearing back in my ear. And then just that cycle would repeat. I did have an increase in fatigue. And I remember saying to one of my coworkers at one point, I'm so tired, man. I really wish something was wrong with me to explain why I'm so tired, because I shouldn't be this tired. Crazy. Thought I would want something like that, but I was so tired. I'd had some shortness of breath, some difficulty breathing. One night in January, I woke up out of a deep sleep, and I can't recall what it was that woke me up, but I remember thinking oh my gosh, I think I had a stroke. I went to work that next morning. One of them took me to the emergency room, and they did a whole bunch of testing on me. It was really just kind of a terrible experience, but they scanned my brain, they scanned my head, but they didn't really look at anything below my neck or my head, and they diagnosed me with a complex migraine and a panic attack, because I have a history of anxiety, I have a history of migraines. They sent me home. I woke up and I had a huge swollen lump on my neck, and nobody knew what it was. And I spent that whole week Googling, swollen neck, what could it possibly be? So I convinced myself that it wasn't cancer, because the internet is going to tell you the worst thing. And then I was I'm going to go to urgent care, because I go back to work on Monday. If I don't go now, I'm not going to go. And then I went to urgent care, and she knew right away. So she did some labs there, and then sent me to the hospital, and she was you should just go get a scan so we can just see what it is. She's like, I will call you personally in a couple of hours to give you an update. And my labs came back while I was waiting for the scan. And the only thing that was off was my platelets, and they were slightly high. And everything else was fine. You know, like my white blood cells weren't elevated. I'm always baseline anemic. So that was it. She called me a couple hours later. All I remember her saying is, there's a large mass in your chest. She didn't even tell me about my neck. She just said, there's a large mass in your chest. You have to go to the hospital. And I was like, what? I didn't even know what that meant. I didn't even know what a mass was. So at that point, I still didn't know that meant cancer. So then I went to a different hospital to be admitted. My husband and everything, we were just in shock. You know, like, he's really great at like just rallying, and like I'm the one that like will fall apart. Like I'm not getting out of bed. I'm not getting out of the shower. I am down. I'm done. Like, I need some time. But you know, he was there. He was at the counter scheduling the appointments. Like, okay, I'm going to drive her. I'm going to take off work. I'm going to, you know, I didn't have to worry about any of that. He took me to where I needed to go. And like, I couldn't do that at the time. So that was great. That was everything that I needed. My kids, I hate that their whole lives basically will be me being sick. They're not going to. They're not going to really know any different, because this is just how it is and how it will be, because there is no cure. But it's all they know, because they were so young. I think that was, you know, to look at it like in a good light, is they were so young that they didn't really know the difference. You know, like, I was sick and in bed, and they just took it. You know, they helped when they could, and they didn't push me too much, and you know, they gave me grace.
Ooh, ooh, demons best.
There was no time to make decisions. They told me I needed chemotherapy, and I needed it right away. And I didn't have a choice. I mean, I had a choice. I signed the paper saying I had a choice, but I didn't have a choice, because it was either that or I was going to die. I mean, within the 2 months that they think that I had it, it had spread all over my entire body. So yeah, I started treatment. I did 6 rounds of chemo. And it was okay at first. And like, it was okay. It wasn't fun. It didn't feel good. I would go home, and that's when you get sick, is when you're home. And you know, the things that they don't really tell you, they try to tell you about as much as they can, but I think everybody responds to it differently. So the first instance of like this diagnosis, because it's been years of, I think, teaching myself, and I will say my oncologist, the doctor who initially, you know, saved my life in urgent care, she's now my primary care doctor. Like, to me, it's all like this massive, like, just, they are my people, my oncologist, he doesn't know, but like he's my best friend, and like I had consult him in my head on like everything I do, like, oh, Corey would not like this, and like, and, you know, like, so they are everything to me. And I don't remember the initial appointment at the cancer center because like I was still like on pain meds, and like I remember looking back and everything's like patient is distraught, distraught, distraught. Like I was a wreck. And so there's only a couple of things I remember about the appointment, but I wish I don't know. I don't know what they could have given me at that moment because I wasn't ready. And I've been thinking about this, and I think that there's ways that the cancer community can approach people getting a new diagnosis and meet them at a place that they're at. And this is, again, not like to discount what people are doing to help people being diagnosed, because I don't think you know until you know. But like I could not retain anything in that moment because I was still on pain meds. I had just had surgery, you know, a couple of days prior, because from my, like I was diagnosed on the 12th, I had surgery on the 13th, I was in chemo within a week. Like, so I had my PET scan, I had my port placed, I had my bone marrow biopsy all within days. I mean, like I didn't have time to do and if I wasn't at the cancer center, I was not getting out of bed. Like, so when I was there, I was like, looking back, I wish they would have given me like a checklist, like 1, 2, 3. Record this because you want to remember, you want to be able to go back and know this. And the only things I remember from that were saying, am I going to die? Because now I know that cancer is not a death sentence. Like if you catch it early, we can treat it, and hopefully. And I remember saying, I need numbers, I need statistics. Like, this is how I work, this is how I operate. And she's like, I don't have it. I don't know. But she called me and she told me, I don't remember what the numbers were, but she called me and she said, you will lose your hair. And that made it worse. The nurse practitioner did the like cancer 101. Hi, welcome. You have cancer. By the way, you will lose your hair with this. Make sure to like really drive it in. And so I woke up one morning after the first cycle, and it just, you know, just coming out. Like you touch it and it's clumps. I mean, that part was like the movies, you know, just clumps and clumps and clumps at a time. And that was really difficult for me because I have a lot of hair and lots and lots of hair. And so we just shaved it, and it sucked. It was one of the worst days. But if you didn't, it hurt. Like, but it comes back. With my disease, it's extremely high risk. And like, for example, my last appointment or 2 appointments ago would have put me 2 years out from chemo. And my oncologist looked and he was like, oh, 2 years out, you know, it's exciting. And he almost started to say, like, we can start to bump out the appointments. And then he stopped himself because I think it's just like a go-to thing. Maybe like 2 years is like it's like a big mark in, you know, treatment time or whatever. And, you know, we can start seeing each other less. But then he stopped and he said, no, you're too high risk. We can't change your treatment schedule. And I don't want to because I know the risks. My first bit of time was I woke up every day like, is today the day? Is today the day? Is today the day? Like, is today, like, my every thought was cancer. I mean, like this just overwhelming fear And I go through periods of where like, it's not like more of a fear. It's like, look, I did it. And the more time I go, that's better, like the less chance I'll have of relapsing now. Like the more time I put between it, the better chance I have. And then I'll flip and I'm like, but I beat all of the odds. So my day is coming. So it's hard. I know when it's like too overwhelming for myself. And I just talk about it. Like I try to turn it in. I can't not talk about cancer. Like it's a part of me now. It's a part of who I am. And I don't know if my need to talk about it is a fear for other people or fear for myself, or like the research out there. It's like, it's devastating for people my age, your age, the future. Like it's not a matter of, I'm unlucky. It's a matter of, we have to catch it before it gets too late, because it's everybody now, and I want to bring awareness to the people around me who don't think that it can be them.
My symptoms of the follicular lymphoma were actually kind of minimal in comparison to what I think a lot of other people experience. And they really only started a couple of months before my diagnosis.
I didn't know what cancer was. I thought cancer was cancer. Cancer is cancer is cancer. There's no differentiation between it, and boy, I was wrong, like I was, there's so much I don't know, and I don't know. So I don't know if I talk about it in a way to help myself, help other people, but I just try to talk about it. And when I'm having a really bad day, I let myself have a bad day. Why? Why? I don't think I'll ever stop thinking that, asking that. I want to know why. It's, I know lots of people around me who've been diagnosed with cancer recently, all different kinds of cancers, and none of them are better or worse than the other one. Some of my friends who have been diagnosed with other ones have gone through much worse treatment than me, but they will get a cure. And I find myself, it hurts. And then I think about like, oh, well, at least I didn't have to go through all of that treatment. But then I'm like, but I didn't have to go through all of that treatment because they know that like the next step for me isn't more like chemo. The next step for me is a transplant. I'm young, and I think a lot of that has helped me, and that's been on my side, is my age. And I know that the outlook for people that are normally diagnosed with this, like if you break down the diagnosis, it's the grade 3B follicular lymphoma. In itself, it's extremely rare, and is not treated as a normal follicular lymphoma. Record everything. I mean, truthfully, like record the first appointment just so you know, because you're not going to remember. But then record everything, like record yourself, take photos. It's possible. Like it's possible to be okay. So I don't want to forget that part of my life because it's who I am now. And it's hard to remember things now. So I have to record everything because my brain doesn't remember anything. So I don't want to discount the things that I've gone through, because I do think it sucks, but I'm better for it.